on to part 2 of what your shoes say about you. If you haven't yet checked out part 1, be sure to do so in order for you to have a better understanding of the topic. So now, let's look at the patterns of shoe wear. When we screen a person's shoes, we often find answers to a lot of questions about the person's gait pattern. For example, in the previous video, we looked at the ground reaction forces and center of pressure and kinematics such as muscular activity. Keeping this in mind, we may be able to understand why and how hard or soft the heel strike is, especially when we compare bilaterally. Also, we may be able to see the pattern of pronation and supination relative to where the person is in the stance phase. Is the person supinating when they should be pronating? Or are they pronating when they should be supinating? Does the person seem to favor one side over the other? For example, the patient with pain on one side only? Or is it simply a question of lower limb dominance? Is there a strong or hard push-off due to pain elsewhere in the foot or limb or in the opposite extremity, or does the person simply drag themselves forward by the heels due to weakness? All of this can give us a clue about present or future musculoskeletal problems. Like I said in the previous video, it doesn't mean that each time your shoes wear out there's a problem with your gait or posture. Just be sure to look out for the normal versus the abnormal. Normally, your shoes should wear out at the outer heel and then across the whole ball of the foot from medial to lateral or from inside to outside. You may want to relate this with the center of pressure and ground reaction forces. This is where the floor foot forces are in highest concentration, hence this specific normal pattern of wear. Now, let's move on to the abnormal patterns of shoe wear. Many of us have feet that would easily hyperpronate. Hyperpronation occurs when the foot slips from its stable position due to collapsing of the medial longitudinal arch and it rolls inwards. When it comes to bracers and releasers, these two have a general categorization. This means that the abnormal shoe wear might affect the heel, the entire sole, or even the insole depending on the severity. Generally speaking, bracers are individuals who feel discomfort from their collapsing arches and they fight this motion. You may have experienced this on days when the inside of your shoe has a slippery surface and maybe you're sweating heavily, or you have water inside of your shoes, or maybe your shoe is just too big for you. The action that you take when you grip the shoe from the inside during walking to prevent the foot from slipping out of the shoes is similar to what bracers do. However, even though bracers try to fight this motion, they usually do not have enough muscle strength to fight this motion throughout the entire stance phase. So, the pattern of shoe wear is characterized by a lateral heel wear. This type of shoe wear can be restricted to the heel only, or it could also cover the entire lateral sole all the way to the lesser toe area. Most of these individuals will have a more laterally oriented heel strike. Releasers freely allow their feet to hyperpronate. They will usually instantly pronate after heel strike because they freely allow their feet to roll inwards. By allowing this, the wear pattern is carried forward on the medial side or inner side of the heel to about the first and second metatarsals and the great toe. Heel wear. When there's excessive wearing out of only one heel, or when the wear occurs either more laterally or medially than usual, this is an indicator of abnormal lower extremity biomechanics. If you find that the wearing out is right below the heel, it's a good indicator that you are striking the ground too hard while walking or running. This puts an excessive pressure on your heel and it could lead to pathologies such as plantar fasciitis or Servus disease in younger people. Sole wear. Again, Here we're going to check for excessive medial and lateral wear of the entire sole for hyperpronation or excessive supination. However, you also want to pay attention to the symmetry of the wear. Oftentimes, asymmetry is a sign of altered weight bearing, such as due to unilateral painful limb or a limb length discrepancy, and the effects of this will be noticed in the pelvis of most people. The danger of bearing weight more on one side than the other is that you might develop structural or functional changes in the spine, such as scoliosis. If there's excessive wear at the front of the sole, just under the toes, it indicates a forefoot striker or a transverse arch collapse. Yes, even the transverse arch does collapse. Also, people with a tight tendon Achilles develop this type of wear eventually. Midfoot strike usually indicates weak dorsiflexus and may often manifest as a slapping gait or steppage gait. The ball of the great toe. This often indicates an equinus deformity. Again, as with the toe walkers, this is as a result of a tight Achilles tendon. The person ends up compensating by picking up the heel early when walking, and this eliminates the toe off phase and places great pressure on the ball of the foot. It can also be caused by keeping the feet pointed downwards while seated on a chair, or by wearing high-heeled shoes frequently. Sorry, ladies. This often leads to pain in the ball of the foot, corns, and calluses on the soles of your feet. The great toe. If your shoe is wearing out directly under the great toe, it means you're putting excessive weight on the great toe while walking, and this is probably due to overpronation of the foot, pain in the heel, a compensated Trendelenburg's gait, or shoes that are too small or too pointy. It could lead to corns, calluses, and even Hallux valgus. The insole. When you look inside the shoe, the foot's impression should be centered. It may be slightly medially or laterally displaced. Be on the lookout for pressure spots that reflect abnormal or uneven weight distribution. Wrinkles in the sole. This is a little obvious because your shoes do break down with each step, causing wrinkles and small cracks. Your shoe is receiving pressure from your body weight as well as from the ground, and with time it begins to lose its ability to absorb shock. What will then happen is you start to feel more fatigue in your legs within a shorter time than usual. This could be a sign for you to start thinking of replacing your shoes. Let's look at the last one, a hole in the sole. What do you guys think about this pattern? I'll give you 10 seconds to answer. Well, if you answered normal, then you are correct. You should be pushing off with your great toe. This is a neutral gait without excessive rotation medially or laterally during walking. Again, this simply means it's time for you to replace your shoes. So, did you get the correct answer or not? If not, what was your answer and why? Feel free to comment it below. And you may have paused this video at some point to check your shoes, or you are probably waiting to do that after watching this video. So, what do your shoes say about you? Are you a bracer or a releaser? A midfoot striker? Or are you neutral? We'd love to hear about your experiences, so don't forget to comment. Also, please like and share so that more people become familiar with shoe screening. Please click on the subscribe icon below so that you don't miss awesome videos like this one. Thanks for watching!